We're now going to hand over to other colleagues, to Stevie and Mel, who are going to slightly change the tone and tell us about something else.
And also get you doing some work.
Yeah, lovely. Thanks, Mel. We always like a bit of work.
Absolutely. So we're just going to kind of talk for 5-10 minutes just to introduce something, but then we're really keen just to get you on your tables, talking to each other, sharing some ideas. Stephen, would you like to introduce yourself first? I'm going to take our lead from Sally and introduce ourselves at the beginning.
Oh,
so, who it is that's talking to you?
Never mind.
Well, as Sally said, I'm the research assistant for the National Centre for Post-Qualifying Social Work, so I get involved in all sorts of different things, like Sally mentioned, you know, the fun stuff, the design, that sort of thing. I've sort of had a big play in developing the toolkit behind the scenes, but also the research and different research projects. I've been involved in this project that we're going to talk about with National Voices. I think Mel's going to talk about it a little bit more.
And Jen, so I'm Mel Hughes, I'm Associate Professor in Social Work, part of the team that you've been sort of introduced to today, very much part of the Research Centre for Seldom Heard Voices. Stevie and I have been involved in some research over the last year with an organisation called National Voices. I don't know if people are familiar with them, but they're a national charity. Collectively, they speak on behalf of and with a whole host of charities that are working across the country. So from the big hitters like kind of cancer research to lots of grassroots community groups and organisations. And collectively they gather kind of information really on what the current issues are, the current concerns, innovative and creative practice that's going on across the country, and they feed that collectively into things like the government kind of select committees, to NHS England, and have that kind of critical mass. Over the last year, when COVID hit and everything went into lockdown, everything shifted online, didn't it? And so they got this massive groundswell of concern from all of their charities and organisations that are part of National Voices about what that meant for people that they were supporting, and real concern that people were being very excluded and marginalised from healthcare as a result of everything going online. So National Voices decided to commission a great big piece of work, and they came to Stevie and myself as part of the Research Centre for Seldom Heard Voices to look at feeding into that by developing some case studies that gave insight into what some of the lived experiences were for people of everything going online. So we were part of, I don't know if there's a slide of, that's okay. So we were, I'll just go back to the other one. So we were part of developing some case studies to look at what the impact of digital exclusion was. What National Voices did was work with some other organisations to look at best practice. So what they're very good at is not just sort of digging deep into what the issues are, but there were some fantastic, very quick into-action projects developed all around the country to try and kind of address those challenges in terms of moving towards digital inclusion. So particularly at the beginning when we didn't really have a choice about being online, but certainly over time when we've ended up with this sort of hybrid approach where a lot of people are still feeling that they don't really have choice and flexibility in terms of how they engage with health and social care services. So we wanted to share a bit of the work with you today very briefly. We've got the National Voices report that we were part of in your pack, so you can read much more about it in detail and see some of the solutions in terms of some of the projects that they've put place around the country. As Sally said, the work never ends, so although we have done that with National Voices, we're now looking at, so how can we support the work locally to amplify and showcase some of the amazing things that are happening to make sure that everybody has access to health and social care. And so we're working with some local partners now to look at how we can really sort of explore together what the solutions might be. So if you could next slide, please. I'm looking forward to saying that. We've joined forces with the Weymouth Important Patient Participation Group. They did a really big survey in the middle of last year, actually kind of during the second wave, the second lockdown, to look at how many people had internet access in And even though we talk about digital poverty, we talk about people that don't want to come use the internet, they and we were still quite shocked at the figures. They basically put a survey through everybody's front door and got a huge response rate. And we got some of the stats on here. Yeah. 91% who do not currently access the internet indicated that they would not consider using websites or apps to contact their GP or help with their medical condition. And bearing in mind this was in about August. This wasn't in March when lockdown first hit. This was several months into everything being online. 24% of respondents who do have access to the internet would not consider using them. Respondents who indicated that they have a disability or difficulty were significantly more likely to not access the internet than those that do not. 70% of those who do not access the internet indicated that they are not interested in accessing it. 38% feel that they do not have the skills or confidence. 24% indicated they do not have the right equipment. Respondents aged 75 or above were significantly less likely to be confident talking on the telephone and describing their problem. So often our solution is, that's okay, we'll phone you. But this huge kind of number of older people, the respondents, didn't want it to be telephone access either. A third of respondents aged 65 to 74 would not consider using websites or apps to contact their GP, while 2/3 of those aged 75% or above would not consider using them. What was really interesting in the survey as a whole is that around 24% of respondents did not use the internet at all, did not have internet access or did not use the internet at all. And when you break that down by demographics and just look at people that had a disability or just looked at old people over the age of 75, the number was even higher than that, and in some cases almost half of the respondents. So although this was kind of a separate piece of work, and we're doing some work, we've got an event that Steve and I are hosting with the PPG in Portland, down in Weymouth in November, where we're bringing lots of practitioners, lots of local people together to kind of go, what do we do with this? So how do we manage this? How do we work through? So insights will come out of that in November. But we realised that today was a really important opportunity to share this with some of you now, and for you to have a conversation through the lens of mental capacity, thinking about the people that you are working with, that you are in contact with. What does this mean for you? So Steve is just going to talk through a bit of the insight work that we did to put a bit of flesh on the bones in terms of what we found. And then we're going to come to you at the tables and ask you to explore what, why and how. So what does this mean for you in your particular role? The whys in terms of, so why for you are these challenges, and then the how. How are you responding to this, or how might you respond to this? So I'll hand over to Stevie to talk through some of the work she did to kind of develop the case studies and what some of the themes were from that research that we did.
Okay, so I carried out all of the interviews. I spoke to all of the participants. I ended up speaking to 11 different people from all sorts of different groups, different experiences. And I sort of went into the project with some, you always go in with some preconceived ideas about what you're sort of expecting to see, what factors you're expecting to see at play. I imagined the older members of my family who still put their phone to their ear when you're on FaceTime and that sort of thing. But it was so much bigger than that, and so many different experiences that I didn't expect. So there were the older sort of participants who were sort of saying, I've been filling my brain with stuff for the past 70, 80, 90 years. I'm not really interested in putting any more into my brain, and that sort of thing. But there was also there was other groups. So digital poverty is obviously a huge issue. Not everyone has access to the digital devices that we may use. That can be for lots of different reasons. But not just that. Sorry. I'm really nervous because I haven't seen any people for like 2 years.
Thank you. Really well.
I hadn't done this many times pre-COVID, but then obviously
we prefer the digital world, don't we?
We do.
Yeah.
Okay. I'm just stuck myself here. Okay, so there are, of course, people experiencing digital poverty, people who are on the breadline, who are sort of, you know, worried that they might not be able to afford to pay their internet bill month to month. So, you know, they're scared to sort of get attached to it even, and that sort of thing. Yes. So with the groups such as the older population or people who are struggling with disabilities and that sort of thing, you can often assume that there will be someone there to support them to use digital technology. You know, a child or a neighbour or something. But I met a lot of people where that was absolutely not the case. You know, they had no one to rely on. But at the same time, people who did have, you know, they might have had a child or a husband or a neighbour, they didn't want to have to rely on someone to get sort of their basic healthcare needs met. They wanted to have that independence, that privacy as well. A lot of people sort of said if they have to have a phone call from their own home, they weren't able to get to anywhere in their house that someone else wouldn't hear them. A lot of people who are sort of retired and at home, their partners are there all the time, their children might be there, you know, whoever, even carers, that sort of thing. So they're not able to have that privacy and independence that going into that private room would give you with your GP and that sort of thing. So I've just got lots of different examples here. I could go on forever, honestly, about the experiences that I heard. People who have really tried to upskill with technology, who have gone to these computer courses and all sorts of things, but they just can't get their heads around it. And then there's one particular one at the bottom here. I met a gentleman who had been in recovery from addiction for about a year at this point, and he put everything into really trying to build up this life for himself. He did have a lot of support from different charities to secure him accommodation, that sort of thing, but he was still really struggling with technology because everything now is done online, and he had sort of been in isolation due to his drug use for a really long time, and in that time everything had developed so much, so he hadn't sort of grown with it as many other people had. So not only was he trying to develop his life skills, he was also having to contend with technology as well. And instead of finding that it helped him out, he was finding it more of a hindrance. And I'm just going to talk specifically about this gentleman a little bit more, because I just think his case was just really interesting. So he described himself as an addict who had really turned his life around. There we go, April 2020. So it had only been about 6 months when I carried out this interview. So he had previously been homeless, really isolated, but like I said, he had been secured accommodation through a charity. So he faced so many challenges. He didn't know how to work a smartphone and that sort of thing. He was trying to find a job, but all the jobs were sort of online applications, online CVs that he just really couldn't get his head around. He said that it really hurt his head trying to get his head around all of it. He also was really struggling with accessing healthcare. So he said that at one point a few years ago he was having one-to-ones with his doctor quite frequently, and he said that there was no way he would have survived without them. He said he was significantly overweight, and he just said he was struggling with all of these things, and he just, he's so thankful that he was able to have those, but sort of says that for other people out there now who haven't been able to have that personal access, he had those worries. So there's just a few little kind of quotes here that he felt that he hadn't been in prison, but he felt that he'd come out of prison, that he'd been isolated, and that he just didn't feel part of this world because he didn't know how to be involved in the digital side of things. So that was one of the examples. But as Mel said, the reports, they have lots of great examples in there, the other case studies that I looked into.
Thank you. So what we would like you to do, we've gone old school, we got excited about being on site, so we've gone for flip chart paper and pens. So, you might want to hand sanitizer, have one scribe, or however you guys do it at the table. We'll bring bits of paper and pen. Literally think about sort of what, why and how. think about some of the things that Steve has talked about. So digital poverty with people having no access to the internet, or sometimes to mobile phone contracts. Thinking about lack of skills or just not lack of interest in wanting to use the internet for access. But also some of those more nuanced things that took us by surprise, that I'm perfectly able to use it, but actually it's completely taken away my autonomy because I'm visually impaired or I'm deaf and now I need help to be able to use the technology, or the bit about privacy. Those were the really strong things that came up. So we would like to just put that out to you, have those discussions on the table. Stevie and I decided we'd just wander around and eavesdrop. So then, because we're quite short on time, we can just do a bit of a 5-minute sort of plenary summing up at the end of some of the things that are coming out from it. Yes.
Could I just ask a very quick question?
Yes.
Before I forget. I just wondered if this research has been linked to Dorset CCG as the Commissioner of GPs, whether there's been that dialogue, because it's really interesting findings.
So that's what we're hoping the event that we're going to be doing in November is. So we've invited them.
Okay.
We're mainly, so that is Dorset. So they've been invited and we've got, I'm trying to think who the other kind of speaker that we found, but that's the patient group, isn't it? But anything you can do, maybe if we forward the invite out and you
That'd be really good.
share it as well and say, oh, you've probably had this invite.
Yeah, and also from a safeguarding adults board perspective, you know, people that aren't accessing their GP, etc., because they can't use digital equipment,
That would be brilliant.
self-neglect, all of those issues are kind of buzzing around my head at the moment. So
we'd love to have that conversation later with you because we really want to get the right people around the table. It's a World Cafe event, which is very much about identifying solutions, exploring an issue and identifying solutions together. So we want it to be a really mixed group because people can just bring in some amazing ideas.
Yeah. There's an integrated care system health and equalities group as well, so across health and social care. So, and I think each individual trust and organisation has got their own health and equalities groups, looking at some of these things which would be fabulous to feed into and public health.
Yeah.
As well.
So if you're probably the easiest is to have an email exchange afterwards or a conversation today and then put us in touch with whoever. We'd be really keen to look at exploring this locally. It's okay if we just kind of get your attention to the front of the room here. So just got a few minutes what we kind of wanted to do, we're going to, after lunch has been cleared, we'll use those tables at the back to put your flip chart links down so everyone can go and have a read. Stevie said she'll sort of photograph them and when we send all the slides out, we'll put copies of them on there. And we're really keen to talk a little bit about the details over lunch and throughout the afternoon as well. But just before we finish up, rather than having every table feedback, thought we'd ask this just from each table, just a real burning issue or a burning thing that just really sums up some of the discussion that you've had, that you just kind of want to put out there into the room now before we have a chance to really read through all of the details. So putting you on the spot, so we'll have to look at each other a bit to think which points. But do you mind if we start at this table? Just one point that you'd like to share that kind of sums up some of the nature of the discussion that triggered.
I think when you're trying to figure out how, you were talking a lot about case involved people that we work with, and just maybe given Ted's very digital approach to interactions with patients and service users when we were going forward, we needed to give people more choice. Some people might still want to have that
So really thinking about how do we manage choice. One of the things that has come up in a lot of the discussions we've been part of with National Voices is some people really like it in terms of the digital world, but actually what we're starting to see is it works a lot for practitioners and services, but not necessarily for patients and service users. So we've got to find a way of living in the new world, but offering that choice. Brilliant, thank you. Should we go to the table at the back? Is there something else you might want to add as part of the discussion?
Sorry, I'm an OT by background and I've got a bit from my soapbox a little bit more about how to move things forwards is just thinking about actually governance. Because yes, this is about patients and everything, but we've also noticed that there's a disparity in technological knowledge of not necessarily patients and service users, but also those really using it, and a lack of confidence for those using it, therefore a little bit of lack of confidence for the service users to pick it up. So we're thinking that actually what is the governance as well, with an issue, appropriate governance within the teams and things on how to deliver it and broadly deliver education and
So like role modelling really. So
Yeah.
actually we're not confident using it. How do we expect other people to be confident using it as a means of contacting us? And there's lots of us that, you know, I mean, we've been using Teams for what, 18 months now. It's like a freight train, isn't it? It's kind of happening like that. And actually we've all had to upskill really, really quickly. And we've struggled with it. So why are we not expecting other people to really? So,
Yeah, absolutely. And interestingly, in the peer partnership, which I'm academically for, is public involvement in education and research, and we put loads of training in and did lot, but it's not enough to learn how to do something, you then need to practice. And again, when we all shifted online in our roles, we were then using it every day and finding the feed. So we haven't had the opportunity. So that's a great point about
It was wrong for the governance was actually red tape and bureaucracy. So what happened for us is when our consultants said that the patients that are commuting who are having acute psychotic episodes, we will just deliver out tablets with some cards into our patients. Cut out the consultation, we cut out the red tape, went out to all the patients, and they realised that that cost, the tablet and the SIM card never came back, was a lot less than them not attending their appointments with consultants or admission to hospital due to acute mental health episodes. They just went and did it.
So there's definitely something about choice, definitely something about governance and actually kind of how we revert to this being a tool of many tools that we have in our toolkit rather than something that we all now have to do and expect everyone else to do. Brilliant, thank you. This table here.
We can talk about loads of different things really, and one of the key issues was where to look for information. You don't know what you don't know. Your analogy is brilliant, Karen.
I would say if you don't know how to spell a word, you don't know where to start in a dictionary. And lots of people feel like that. They don't know what they don't know. They don't even know where to start. I think one of your quotes was people don't even know how to turn anything on.
One of the quotes I refer to all the time when receiving your interviews was one of the case studies that we have. She said, they told me to go onto the app, and I said, what's an app? And I use it all the time, what's an app? And it absolutely, that's the level sometimes that we're talking about. So to then even know how to use it, and she kind of said, oh, my grandson said he'll buy me all the tech. I'm not interested. So it wasn't about money, it wasn't about poverty, it was, I'm not interested. So yeah, what's an app? Thank you. And then table at the back, there are all sorts of discussions.
Well, I think health literacy, 38% of the population in the South West have poor health literacy. If you combine that with numerical poor literacy as well, how you describe your symptoms or even recognise your symptoms in the first place to be able to describe it either on the phone or through the IT system, the e-form, is really challenging, you know.
And we're relying, it triggered conversations for us about personal experiences and family experiences, where people are essentially being asked to self-diagnose.
Yes.
So so what do you think it is? And I shared an example, and she won't mind sharing it, of my mum spent a month in hospital because of being misdiagnosed, because she self-diagnosed, because the GP said, what do you think it is? She said what she thought it was. He then prescribed based on that, and it was completely wrong. And it was only the paramedic coming in that within 3 seconds went, it's this. It was sepsis. So that's one personal example, and we were saying, I mean, how many, even that day did that happen? Because it's something, really, what do you think it is? Or filling out those e-consult things where I've done it for my own health issues and ended up ticking boxes that don't apply. The one that applies is listed, but I need to get to the end of the score. So it's what's shared with very easy. field being represented, or in terms of understanding human behaviour when
Yeah.
we're looking at solutions?
Yeah, because, you know, it's like responsibility. If I make this decision, it just seems like, oh, well, we'll try this one out. If it goes wrong, then, you know, it's a crisis, then we'll do something about it. But then, if it'd been thought through enough, the people involved in who they're making the decision for involved, plus the psychologist, then you're more likely to make the right decision in the first place.
What an important point. Can we end on that one? Because I think that's brilliant. I'm going to keep quoting you, Sally. The work is never done. We're always looking at what we're doing next. We're really interested in exploring this locally and facilitating some of that work. So certainly those of you that straight away went, are you involved in these? Could you involve this? Please come and speak to me and Stevie to make sure that happens. After lunch we'll put these out so everyone can read them. So